We're with Brayan Bunyi with the Department of Children's Services. And Brayan, thank you for being with us today.
You're welcome.
Why don't you tell us a little bit about some of the services that are offered to the Department of Children's Services?
Okay. Well, the Department of Children's Services is basically broken up into different units. One of the main ones, of course, is Child Protective Service.
Okay.
And another is Social Service and Juvenile Justice.
All right.
Currently, that's what the three main programs are with us. And with Child Protective Service, of course, is when we go out and investigate cases that are referred to us.
Okay.
Social Service are cases where the child is already in state custody.
All right.
And we have case managers that are overseeing those cases. And Juvenile Justice cases are children that if they break a law, that if we break them, it's illegal.
Right.
So things like stealing and vandalism above $500, those kinds of things would fall under juvenile justice. So they're more of the delinquent children,
Okay.
the higher need children. So those are the three main areas that we have.
All
but
right.
there is also now more of a focus of prevention with Department of Children's Services. So a new term that's coming in to our program is the multiple response system.
Okay.
And this includes resource linkage. And that's probably the most important aspect right now for us, because we are trying to prevent children from coming in by linking them with resources in the community.
So a student would really have to know something about community resources to function in that position.
Absolutely. Okay. They would need to know things such as counseling for families and children, where to go for food items and places for shelter and such.
Okay. Now you've been with the department for about 8 years now,
Yes.
is that correct? Why don't you tell us a little bit about the types of roles that you've had in the department, and then
Okay.
I'll ask you some questions about those.
Okay. When I graduated from a university, I had a psychology major. And as soon as I graduated, I submitted my application into the state. And what they do is, of course, it goes into a central location, and they try to identify and match you with the kind of position that you want.
All right.
And immediately they linked me with working with children and families. And when I first came in, I didn't know really what they were wanting from me, because the position they were interviewing me for had just been created. And it was for placement service division.
All right.
So my role would be to place children in foster homes, and also to manage the foster homes themselves. I would need to make sure that all their in-service hours are up to date. I would need to
The foster parents?
Yes, of the foster parents.
Okay.
And then I would need to do their home studies. Whenever an applicant came in, I would have to type up and write their home studies, which usually required background checks that I would need to do. I would need to go and visit the home and assess them and their families and their dynamics,
Okay.
and their references. So
What was the reason that kids would be placed in foster homes?
what would be some of the reasons?
Yeah.
The main ones are physical or sexual abuse or abandonment. Usually there's three different categories that we place them in: dependent, neglected, unruly, and delinquent.
Okay.
Dependent, neglected is usually when it's not the child's fault. The family had some issues and they could not provide the needs of the child. And then for unruly, you know, that's something that's commonly heard usually, is when they're in the school system and they're not coming to the school, or they're being truant, or they're skipping classes. We receive the referral actually through the court, and then we have to have them, you know, under the radar basically. And usually what we find is someone that is unruly will also have some issues at home, and so we'll have to manage that case. And delinquent, the one that I told you about earlier with juvenile justice, these are our older children that have committed assaults and are requiring the higher needs. And so these children are usually at a different level. The Department of Children's Services, going back to what I was doing, we only service level 1 for placement of children.
Okay.
And with level 1 placement of children, that means they're the least restrictive environments. These are usually the children that are dependent, neglected, and unruly. However, for the delinquent children, the juvenile justice children, these are kids that are in a higher level 2, 3, and even 4. The ones that are up to level 4 could be placed more in facilities because they may have issues such as A&D issues.
Okay, alcohol and drug.
Alcohol and drug. They may have problems with, they may be fire starters, and of course they have a habit of stealing constantly.
Okay, so basically the levels are dependent on the severity of the behaviors.
Exactly.
Okay.
Yes. The severity of the behaviors, and that's another thing about the department, is that we provide services for these types of behaviors or problems that they may have.
All right, great. So in your original job then, you would have a lot of interactions with the foster care parents.
I did.
Okay.
I was required to do home visits with them. But as far as with the children themselves, this has changed a little bit.
All right.
But when I first started, I was working in the office and where the children were coming in, and so I would actually get to meet some of the children that are coming in, and I would get to talk to them and see where they were as far as the maturity level and developments. But now we have placement workers where they could be stationed in different counties. And I probably need to go back and say that although I work for the Department of Children's Services, I work for Mid-Cumberland region. Okay. And this encompasses 12 counties altogether. Rutherford is one of them, Williamson is another, and we're basically the counties that surround Davidson County. Davidson is such a large county, they're their own region. Now, going back, the placement workers, they could have as many as 3 to 2 counties under them that they're placing children for. Okay. So that's what I was saying with, now I think most of the workers may not be able to see or meet the children for placing them, but it's more of a staff personnel type problem, I guess.
All right. Now I know that a lot of our students, when they think about the cases of abuse, going out to do an investigation, that it can be somewhat of a daunting thing because they don't know what to expect. They don't know what they're going to find. They don't know if the parents themselves are going to be unruly. What would that be like to go out to do that kind of investigation? And how do you let the parents know? Do you let them know ahead of time, or just knock on their door? I mean, how does that all work?
That's a good question. Usually we don't inform the family, especially if they're the ones that have a referral on them. We don't let them know of if it's something of a physical or sexual or severe abuse, where we know for sure that, hey, these children will need to come in because, you know, we visited the school, we saw the marks on their bodies, and we'll have to go in there and make sure it's not expected. And what happens is, in cases where we know that we have to take small children and bring them into state custody, what we've done before is we've had officers with us, and we go in there and then we talk to them, and we say, these things have been alleged, and we've seen evidence. And we've received approval from the court system.
What are the typical reactions you get?
It's anger.
Yeah, I bet.
Yes, anger and more anger, really, and confusion and hurt, and it's very very difficult to see something like that.
Is there a lot of denial that goes on at that
there
time?
are some denial too. You know, I don't understand. I can't believe that's a lie. That's never happened. And so what we try to do is we give them information on what will happen to the children.
Okay.
We tell them the children have to come in, and we'll have to find a safe home for them temporarily.
Okay.
You may have a relative or a kinship that could care for them, but we would need to do background checks on them.
Okay.
And but if that doesn't work out, we'll have to place them in a foster home.
All right.
And our main message that we try to put out is that even though that happens, is that our goal is not to take the child away and keep them away from the family. We want to work with the family.
Okay.
But our first priority is safety
of
the child. So that has to happen. And then when the children do come in, we already start formulating plans to work with the family and how they can get the child back into their home.
So this is where the court might be involved at this point in terms of getting a placement for the child and getting all that legally authorized.
Yes, the court could actually be involved before that.
All right.
Because we can get referrals from the school and from the court.
Okay.
And the court could notify us and say, we need you to check this, and we need you to see if it's if it's valid, and then the children may come into custody.
All right.
But in instances where we get a referral from our central intake, regardless of what happens, the court is going to be involved with the family. When the children are in state custody, the families and the Department of Children's Services basically go to court, and we share with the judge what the case is about.
Okay.
We share with the judge what the plans are for the family to get the children back.
Okay.
And depending on what the families, what they do, if they meet their goals or not, then they're able to get the children back, in a manner that they want.
Okay, so the parents wouldn't necessarily go to jail or anything. There could be alternate plans that could.
Right. They could, they could just work with us and do that. But there are instances where the abuse is so severe that the our police department and the court will say, we have, unquestionable evidence that children have been abused. You're going to jail, and the children will be under the care of the Department of Children's Services legally.
What's been the worst case you've heard about or you've had personal experience with, Brayan?
Oh, usually the worst ones are where the children have been exploited. They're young children, and they've been exploited sexually or physically. And when I was doing placement with children and families, the worst ones that I heard, and I coming from my frame of reference, is that the mother or the father usually chose their boyfriend or their girlfriends over their children.
Horrible.
They would relinquish responsibilities just so that they can be with their boyfriend or girlfriend instead of taking care of sibling groups. So, but the worst ones are, of course, the sexually and physically abused children, and it can be as shocking as the grandfather or grandparents that are sexually abusing or physically abusing children. So you really have to have a stomach for it, really. And the other thing too is you have to have a sense of foundation, a good foundation for yourself, because it can be draining. But at the same time, you have to make sure that that you're able to work the case, and to do that, you have to be non-judgmental. Sure.
So you have to be able to distance yourself emotionally,
yes,
and not judge people.
Exactly. One thing that I try to remember is that, I wasn't folks may not have been raised or given the same beliefs or opportunities or
Right.
education, and they behave a different way.
Sure.
But in order to help a family and the children, the judgmental part of you has to be at bay. You have to be aware of it at all times.
So once a child is placed in a foster care home, what might be some of the responsibilities of a caseworker at that point in time?
Okay, good. The children, of course, will need to have their medicals and dentals and their health basically taken care of, and also their education.
All right.
So the worker is basically serving as a legal parent for the child. They have to make sure all those things are taken care of. So they may need to contact the school and because the child was pulled from the family. They may have stopped going to school, or they may need to go to a different school. And so the worker has to take care of those kinds of details. And so the worker would need to be comfortable with working with the school system.
All right.
And of course, they'll have times when they do contact offices and doctors to get their what we call EPS-DNT, early periodic screening and testing.
All right.
And those are the main ones that they're responsible for, the health and education of the child. And of course, because that's a traumatic experience, we take every removal as a traumatic experience. There's potential that the children would need to go and seek counseling, one-on-one or family-type counseling. And the worker would need to make sure that that's being done. Another thing that the worker would have to be responsible for is ensuring that the plan is being followed by the family.
Okay.
So the family, there may be, again, issues with alcohol and drug with the parents. The worker would need to make sure that the parents are following up on attending 12-step programs. Okay. So those kinds of things, the worker really is not just working with the children, but also with the entire family.
And do you offer parenting classes through your department as well?
We do. We offer parenting classes in terms of foster parenting classes, but we contract. We contract with consortiums and different agencies for classes. Currently, we contract even with the universities around the area, like MTSU, Austin P. And we sometimes have cases where the families may need more than the parenting classes, and we also contract with agencies to get them services that they need.
So part of the caseworkers, what their roles are going to be making sure that the child's medical needs, dental needs, the educational needs, counseling, and legal. Is there any legal?
Yes, there are some legal implications that they may need to be aware of, especially for older children, because realistically, there are some children that don't get to go back to their birth families, and legally, the worker would need to know about adoption and parental rights termination. Okay. And so thankfully we have different workers for that too. We have an adoption specialist or permanency specialist where we transfer that case over. But they would need to know things such as, when parental rights are terminated, what are the rights of the parents or the adopted parents. If the child turns 18 and they go into post-custody, what are the rights of the child? Do they still get Social Security? Do they still get insurance? Do they have? Are they allowed to get insurance for driving and such? So, do they have education grants or money that they can acquire because they've been in custody? So there are some legal things that they need to know about, especially because the worker they have to go to court.
Mhm.
They also
That's what I was wondering about.
Yes, they
Yeah.
go to court and they represent the child.
Okay.
And they talk about and then they update the child on them.
Okay. What's just a couple more questions, Brian? What's been the most challenging part about your work with the Department of Children's Services?
Oh, I had a good answer for that. Let me see. I think I might have written it down.
All right.
I did write it down.
Okay,
because
good.
when you emailed it to me, that was a really good question.
Yeah.
Okay. For me, the toughest part is because we're such a large agency, we're statewide, folks tend to generalize our workers and say a case happens all the way in East Tennessee, and there was a mistake that had happened. Our workers in our entire department gets generalized for not doing a proficient job.
Right.
So that's one.
It's got to be frustrating.
Yes, but to tie that in too, though, it's hard for us to let the community know or to involve the community in the process, because we're just one small aspect of taking care of children and families.
Right.
We really need the community as a whole.
Sure.
So one of the main problems we have is having the community to take ownership of the children and families that are coming in to care. So that's probably for me the most challenging part. And what we do, what I do, and what my unit does is we go and we go to the community partnership meetings. We'll seek out different agencies like the Boys and Girls Club, the Murfreesboro Housing Authorities, even the police departments. We bring them to the table and we discuss with them, the data for their county and their community.
How often do you guys meet like that, Brian?
We meet once a month,
Okay.
and to really get them involved. What I've done is share cases with them, but giving them just general information.
Right. Sure.
Such as a family here needs some utility rent to make it through. And it's been successful so far, but to really get down to where we're not enabling the family but empowering them, what we want to see is more of a connection and saying, okay, here's a church and we're willing to link up with this family and take them under our wing. And
so networking is very important.
It is.
To have that team approach.
Yes, and in working with us, that's one of our main things, is making sure that you're able to work in a team-oriented environment.
And I guess that kind of segues into the last question.
Okay.
I wanted to ask you, what would be good preparation if a student was interested in working with your department? What would be good preparation, good experiences?
Okay.
What should they do?
Definitely they can volunteer with the Child Advocacy Center if they have a need for it, domestic violence shelters, and different kinds of helping fields. Even with the senior center, we found that some of our grandparents are having to take care of grandchildren.
Interesting.
Yeah, and so, but of course, we also have a volunteer and internship program, and I actually help approve some of the volunteer and internship applicants.
Okay.
So what they can do is they can contact the local offices and let them know that they want to volunteer or do internship, and we have that program. They would need to go through, of course, background checks and fingerprint.
Okay.
But then we would approve them, and we could see what they're interested in and try to get them with that certain worker to basically learn from them.
Okay.
So
fantastic.
Yep.
Okay. Good. Well, Brian, thanks so much for spending some time
You're
with
welcome.
us today and giving us some information about the Department of Children's Services.
Okay. Thank you.
Thank you.